Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. Humana is one of the nation's largest players in the Medicare Advantage market, with more than 4 million lives covered under those plans. And about 2 million of those lives, those members, see a primary care physician who is engaged in some form of a value based contract. And according to a report the insurer put out in early October, those patients are getting preventative screenings at a higher rate than seniors in traditional plans. They're seeing costs overall are lower for those members and a host of other benefits that Humana is seeing in value-based contracts. I'm pleased to welcome today Dr. William Shrank. He's Chief Medical Officer at Humana, and we're going to talk about the future of value-based care, especially in wake of the pandemic. Will, thanks so much for being with us.
Thanks for having me.
So I sort of set the stage at the outset on the report you guys put out in early October. It's an annual report you do on the state of value-based care and the arrangements that Humana has. Walk us through some of the benefits that that report is showing. Obviously, again, the preventative screenings are up, some of the costs are lower for those members, but what are some of the highlights that you saw?
Yeah, well, I think one important thing to recognize is that we at Humana and Medicare Advantage in general have been able to adopt and move more rapidly to progressive value-based contracts than we've seen in other parts of the healthcare industry. We report that about 2/3 of our patients are now seen by providers in value-based arrangements, and nearly half of them are seen by providers taking meaningful downside risk that are meaningfully and deeply aligned with us financially and with the patient financially to deliver better care, more efficient care, more coordinated care, more preventive care, deliver better outcomes and at lower costs. I think the other key thing to realize is that these transitions are hard. It's not as though you flip a switch and providers can immediately transform the way they deliver care. But we're seeing now in these relationships that we've had for years and years that we're seeing continued improvement in terms of the quality of care that we're seeing is delivered, continued improvement in terms of the outcomes and fewer hospitalizations, fewer visits to the emergency room. Continually, we're seeing more and more savings, and we're seeing our patients are having better experiences. So in general, I think we're seeing within the Medicare Advantage program in general, and our experience in particular is that the move towards value-based care is moving more rapidly, and we're seeing more and more affirmation that the results are positive.
So that movement that you're seeing more rapidly, obviously it's sporadic across the industry though, because we don't see it with everybody and every insurer, every provider in that regard. You said earlier that you can't just flip a switch and move into a value-based contract. Given your experience, what are the biggest pitfalls that you see? What are some of those things that the provider community is having the hardest period to adjust to?
Yeah, well, I think it's hard for providers who are still straddling sort of both a move towards value and a continued participation in fee-for-service arrangements. And those providers that we see trying to straddle both worlds to be successful in both, it's hard to do both at the same time. It's hard to ultimately, the providers that we're seeing that have really great results are those that make the commitment, that sort of make the jump. And then overwhelmingly across the populations that they serve, that apply the same approach, the same philosophy, the same orientation, which is around really caring for the population with the aims of keeping people healthy, providing more care coordination, providing more touch points, really focusing on quality and prevention in order to make sure that the patients are staying as healthy as possible.
And how much do you nudge them, and how do you do that in a um, you know cooperative way? Because obviously the tension between provider and insurer has always been there. So how do
Yeah.
you pull them along?
Well, I think the best way for us to participate with providers is really to meet them where they are, not to push them, but to understand that there's a continuum. It's not as though there are two ends of a spectrum, but providers can fall anywhere on that continuum of readiness and preparedness, and sort of depends a lot on what the market in which they operate looks like, and what other payers and what other arrangements are available to them. So it's really our job to listen, to talk to providers, to understand where they are and where they're comfortable today and where they're willing to go. And then it's also our job to be responsive and nimble and flexible in terms of providing them with the data they want in the way that they want it, to provide them with wraparound services that address the needs of our members, their patients, in areas that if a provider says we've got all the care coordination services we need, that's great. However, if they'd like us to provide more of those care coordination services, that's available. We can be more nimble. We can provide more services to the home. We can work to, sort of be real true partners in how care is being delivered, and how we support providers to fill in any gaps that they have in terms of managing the health of the our population that they serve.
And you're doing some work on some of that as well, the wraparound on social determinants, right?
Yeah, I mean, that's an area where a primary care practice, for example, just may not have the time or resources to be able to build that sort of local library of community-based organizations and social services that can address a whole host of health-related social needs that we know are so critical to patients achieving their best health. And that's an area where we're doing that pretty systematically across the markets in which we operate, and we're eager to be a partner in that regard, and to help facilitate our members, the patients of our physician partners, to get those referrals that they need.
Right. So at the outset, you talked about sort of the pace of value-based care. CMS itself and CMMI, where a lot of their initiatives are rolling out of, have seen some inconsistent performance at best out of some of the initiatives they've rolled out, some of the value-based initiatives they've rolled out. So as you think about where you are, where some of the other large insurers are, and then the inconsistency we're seeing at a federal level, what are your thoughts about how we get towards a more consistent approach to value-based contracting nationally?
Look, I think it's a challenge. I think one of what we saw the Innovation Center sort of do at the outset is offer a whole host of different models, a whole host of ways that providers can engage, with the goal of both learning which are the models that are most effective, but also to build that sort of wildfire of opportunity and a sense of some inevitability that there is going to be this movement from volume to value. And I think the Innovation Center has done, over the last decade, an incredible job of really facilitating and creating that energy of activation to really get the whole market to begin the shift. However, there's a lot that the private sector, the private payers, are in a better position to do. We can be a lot more nimble. We can be a lot more responsive. We can offer a whole host of different kinds of services that CMS is just not organized to do. CMS isn't organized to be able to deliver networks of community-based organizations to address social needs. They're not organized to be able to deliver home-based care or care coordination services. They're not organized to be able to sort of wrap in utilization management as needed by providers, or prior authorization as needed by providers. So in a lot of ways, what we're seeing is while CMS and CMMI play this incredible role and continue to play an incredible role in helping to move the industry forward and to continue to create learning and the sense of urgency and inevitability of moving towards value. That the models that are maturing faster in Medicare Advantage. That we're able to sort of create deeper and more meaningful partnerships with providers. And part of it is that we're seeing more movement towards prepayment, global payments, the kinds of really fundamental shifts in incentives that where providers are sort of oriented around the health of the population in a very, very deep way. And that CMS, for a lot of good reasons, has a lot of different steps along that continuum. Regardless of who you ask, whether you ask CMS or whether you ask private payers, that idea of moving providers to arrangements where they're prepaid, where there's some global capitation, there's no question that that's where we're seeing the most clinical innovation, the most clinical transformation, the most meaningful changes in the way care is being delivered. And I think those are sort of the key learnings here about that, that we're seeing, regardless of whether you ask CMS or whether you ask private payers.
So I imagine I think I know the answer to this, but we don't know what's going to happen at the Supreme Court with the ACA case. And, if it were overturned, then presumably a lot of the work that CMMI is doing would go away because the underlying law would be gone. But I imagine from your perspective, the horse has left the barn already because on the private side, because you're so far down the road. But yeah. Would you worry about any pullback on the federal level if some of these programs were to go away because of a court ruling or legislative action down the road?
Well, I mean, it's hard to comment on what would happen at a federal level. But I can say with complete confidence that from the perspective of Humana, and I'm going to say with very, very high levels of confidence from the perspective of other payers in the Medicare Advantage space, the partnerships we're creating with providers, the alignment we're creating, and the richness of benefits that we're seeing for our members are all the proof we need. And we are gonna. I don't think we're not going to turn around based on the results of any legal cases. And I'll say our providers aren't asking to go back either. Our providers who are doing this and doing this well, their work is much more aligned with why they went to medical school in the first place.
Sure.
They're focused on taking the best care of the people that they're serving, listening to their patients, understanding their patients' needs, being more consumer centric and more focused on really just optimizing health rather than focusing on visits and RVUs. So I think you're going to see, you would see regardless a continued momentum from providers and from private payers for this to continue to move forward.
Got it. And lastly, Will, in the last couple of minutes we haven't talked about the pandemic, but we should. One of the things that people have been telling us is that if there's a silver lining to the pandemic, one of those things is that it necessitates this need to move towards more value-based contracting. Can you talk about what you're seeing in terms of the providers you work with, and what does the pandemic do just in terms of the underlying metrics you may have in place for contracting going into 2021 and 2022?
Yeah. Well, I'm glad you asked. And look, it is hard to talk about silver linings at a time that so many people are suffering. But we are just all overwhelmed with gratitude around how providers, nurses, frontline healthcare workers have just stepped up and truly, they've made incredible sacrifices and done the right thing to take care of their patients and our members. And the partnerships that we've developed throughout this pandemic have really been gratifying, and the sort of alignment around the mission. We have seen that those providers that were in arrangements where they're prepaid were just unbelievably nimble and be able to move on a dime. We talk about how hard it is for healthcare to change. Healthcare changed unbelievably in a matter of weeks. Yeah, we saw docs that were taking care of patients, 1% of their visits were telehealth, go to 95%. That care in the home was being delivered very differently. That just the types of contacts were just changed literally on a dime. They changed immediately, and that was those providers that were prepaid. Those providers that were in global payment arrangements had the sort of financial stability to be able to not worry about the impact of doing the right thing for their members. Overwhelmingly, we saw providers do the right thing for their members, but those stories I think are compelling. As providers didn't have to take risks to do the right thing, I think others saw that the financial sustainability, that the resilience that comes from a value-based contract looks even more appealing. So there have been more and more, higher rates of conversations, more rates of providers coming to us and saying, what can we do in the shorter term to address some of these resiliency issues, and try to move more rapidly to value-based care. And you know what, it'll be really interesting as we go into next year to see how those numbers turn out.
Do you have to recalibrate some of your baseline metrics though, because people weren't coming in for a mammography or a screening or some other procedure? Do you have to rethink that as you think about your metrics for the following next year?
Well, a lot of that is actually a discussion with CMS and how sort of the STARS ratings are calculated, and CMS has been incredibly, amazingly forgiving and an amazingly great partner for payers and providers to try to figure out how to navigate some of the issues around whether it's documentation, whether it's specific, quality measures over the course of the pandemic, so that we kept the incentives aligned with what we were trying to produce, which was keeping our members and our patients safe and delivering the best care we can. So yes, there was a whole bunch. I mean, you're exquisitely aware of all the different waivers that CMS produced that align, that sort of altered how we think about benchmarks and documentation this year. I really hope that we're coming out of it on the other side, going relatively soon. I think it's been really a great partnership with CMS.
Right. Well, good. Well, Will, listen, we appreciate all your time. There's a lot going on. We'd love to stay in touch as you continue to roll out some of the value-based contracting you're working on, and for the remainder of the year and into next year. So again, thanks for all your time today.
Thanks for having me. It's always good to see you.
Thanks. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.